Hello, everyone, and welcome to another edition of your Rehab Power Hour. This is your community to engage in virtual rehab together and a place to discuss all things neuro rehab, from the science, the people behind it, and the individual journeys of recovery. I'm your host, as always, Dr. Nick Housley. So thanks so much for being here on this Wednesday, our hump day. Hope you're having a great start to your week. And as always, we welcome anyone recovering from a neurologic injury, their friends, family members, or care partners, as well as their clinicians, to engage in this community with us and ask great questions and have some good dialogue. As always, we welcome your questions and your comments. And if you want to reach out to me, there's three primary ways. The first of those actually in the live stream. So feel free to drop me a question here, drop me maybe a suggestion for a topic, or even a question for one of my guests. Love to hear from you in the live stream, and we can kind of get that discussion going. I see a couple of you guys are already here. Welcome, Lily, and thanks Bethany and Heather for being here, as well as Jerry. Hope you guys are having a good day so far. There's also two other ways you can get in touch with me during the live stream today, and that is via email. You can email me at rehabpowerhour@motusnova.com, or you can give me a call at 404-594-4244. That line will allow you to leave a voicemail, and I'll be able to play that voicemail on the air, and I can answer your question then. Also, those the latter two ways to get in touch with me, the phone line and the email, are open 24/7. So if you have interest in talking about neuro rehab late at night, feel free to drop me a line then, and I'll be sure to answer your question on the next Rehab Power Hour. I want to quickly just remind everyone, if you do find this helpful, feel free to like and share the video, as well as join the support group. We're growing at a nice rate, and we're trying to really get the word out about the importance of neuro rehab. And the community is a great way to interact together. And so if you do find that helpful, feel free to share the group with any of your friends or care partners, as well as any individuals you think might benefit from it. I just want to remind everyone that we do have a live session going on right now. So what I mean by that is, if you have a Motus hand or a Motus foot, and you're interested in doing another hour of rehab right now, you can go ahead and power on those devices, and you will see a welcome sort of a pop-up window that will invite you to join a shared prescription. And this is another way we can kind of do another hour of rehab during the week. Also, if you don't have a Motus hand or Motus foot, no problem. Get your home exercise program out, your exercises out that your OT or your PT gave you, and feel free to start those, and we'll keep you company while you do those exercises this afternoon. As a quick, just a reminder, guys, we have a couple of contests going on right now. So like last month, we had that drawing for a free month subscription. We have another contest going on in the month of April. And so there's two ways you can enter. So look out for those rules in the Facebook group or in Instagram. There's two ways. The first of those, I think, is actually indicating doing an assessment. It just takes a couple of seconds to do that. The other way is to share sort of a story of recovery. And so there's two ways to enter, and look for the details in the Instagram or the Facebook group. I know our social media team has put those up, and they will do a good job of describing those going forward. But you can enter both ways and get a chance to get a free month subscription with your Motus hand or Motus foot. Very good. We have a couple of guests today, and I want to devote as much time as possible to you guys. So I'll actually go ahead and introduce my first guest. It's a great pleasure to introduce you, Dr. Veronica Rowe. She is an occupational therapist and an assistant professor at Georgia State University, and is hopefully going to be a colleague of ours going forward with respect to maybe doing some science together. And so I'm really excited to have her on to tell you guys about a little bit who she is, some of her sort of interesting research interest, and some of the projects she's done, and some of the things she's learned over the years, and also maybe talk about some of the things that she's going to look forward to doing in the future. So welcome, Dr. Rowe. How are you?
Well, thank you, Dr. Housley, and thank you all for letting me join you today. I'm really excited to meet you and hear all the wonderful things that you're doing. Just to give you a little bit of background about me, and I'm happy to tell you more if you're curious. I am trained as an occupational therapist. I'm licensed and registered as an OT. I also have training and education as a researcher, and I really love to be able to combine the two. My career started in St. Louis mainly, where I went to graduate school at Washington University for. Can you hear me okay? I think I just.
Yes. Apologies there.
No problem. In St. Louis, I obtained my OT degree at Washington University and a degree in research at St. Louis University. After going to school for what seemed like a really long time, I worked as a clinician, as an occupational therapist, mostly in hospital settings. And mostly the main diagnosis that I worked with were in the neurorehabilitation area, specifically stroke and brain injury. I worked in a variety of settings, both in St. Louis, in Baltimore at Johns Hopkins Bayview, and in Atlanta. I got to combine my 2 degrees and work as a researcher and an OT, doing research at Emory on different types of stroke rehabilitation interventions as well as assessments. I'm also a teacher. I taught at the University of Central Arkansas, where I'm originally from, for about 13 years in the occupational therapy department. And while there, I obtained my PhD in occupational therapy. I've recently moved to Georgia State University and I'm teaching in the occupational therapy department there. I'm really excited to form a lot of collaborations with people like Motus Nova and other people in the Atlanta area. It's a great place to form collaborations and do research. So I get to do everything that I love, helping and working in OT, teaching students to become occupational therapists, and doing the research that I really enjoy that's really focused on neurorehab, specifically stroke interventions and assessments as well. I also have done some work or did some work at the Shepherd Center in Atlanta, working in the brain injury unit. So I also have a certification as a brain injury specialist. So that's a little bit about me. My research projects to date, I've been involved in several research studies, as I've said, looking at different types of stroke interventions, as well as assessments. While I was
Dr. Rowe, I apologize for interrupting. I think we use this term a lot, interventions. I think it's also kind of helpful sometimes to break things down, because not everyone may be familiar with that. So can you maybe just describe what you mean by interventions?
Absolutely. I apologize. Sometimes we get
No, it's fine. Yeah. Yeah, we get a little jargony. It's okay. Yeah,
we do. And please interrupt me at any time if I say something that doesn't make sense. So by interventions, I mean treatments, things that we do to help you get better. I have done a lot of things to help improve movement in the arm and the hand. That I'm sure you all know, after a stroke, it's typical that one arm and hand doesn't work as well. It might not work at all. Or it might not work just as well as it did before, or it might be kind of halfway in between. Maybe it works a little bit, but it's clumsy, it's inefficient, it's difficult to move. So I like to look at different ways that we can help you improve that movement. One of those ways that I've worked.
Yeah, I was going to ask exactly what was some of like the ones that you've used in the past, some of those treatments.
Yeah. So one of the biggest treatments I've probably worked with was in a research study at Emory, looking at something called constraint induced movement therapy. And in a nutshell, constraint induced movement therapy means putting some type of restraint or device, or actually just a reminder on the person who's had a stroke on their stronger arm and hand. So the one that wasn't affected by their stroke, which keeps them from using that hand and forces them to use the other hand. It might sound a little mean, and I'll be honest, some of our participants didn't like it. But the big thing is we obviously explained what we were doing and got their permission, and they agreed to do it. But what we found is that type of intervention or rehabilitation treatment that we facilitated really helps improve movement, because when your arm is weak, it's not efficient, it doesn't move as fast as it usually does, you tend not to use it. So if we force you to use it, it tends to get better. Along with that forcing to use, we also worked with people in constraint-induced movement therapy while they had a mitten or something on their stronger hand to use that weaker arm and hand, do a lot of repetitive movements, a lot of functional movements, to really use that arm and hand. The constraint-induced movement therapy is a rehab intervention or a method that we use a lot. It's been used a lot, has a lot of research behind it. With that, it's also sort of continues to grow. So with constraint-induced movement therapy, another type of rehabilitation that we can help to improve not only movement, but overall function, being able to do the things you want to be able to do, is called task-oriented training. And so we might do some of the constraint-induced movement therapy within task-oriented training, which again, in a nutshell, is a rehab method that we use to help you get back to doing what you want to do again. And we really focus in that methodology or that treatment in working on tasks that the person that's had the stroke wants to work on. So if your goal is to be able to brush your teeth again, or to button your shirt, or to cook a meal, to play the bagpipes, whatever it is that's important to you and specific to you, those are the things we're going to work on. And we're still going to encourage you to do a lot of repetition with use of your affected arm and hand, but really with your whole body. And sometimes helping you to break down tasks. So maybe making them a little bit easier so that you can use that arm and hand or that leg and that foot during the task or during the activity. And then as you get better, making it a little bit harder so you can continue to improve.
Yeah, we call that adaptive task practice. I also call this kind of, you can do this called task decomposition, where you kind of take the component parts and you work on them and then you slowly build them up together. Exactly. Yeah, we had a great conversation with Dr. Wolf came on. As a regular guest on Rehab Power Hour and on our Mondays. And he actually gave a great kind of historical perspective about what were some of the motivations of constraint therapy. We even talked about some of the foundational science from Randy Nudo about why do we even think about this idea of doing a lot of movements. And so yeah, this is great to kind of hear your perspective on it as well, and like the actual applied version of constraint therapy.
Yeah, I'm so glad you mentioned that. Dr. Wolf is a mentor of mine. I've learned an immense, I continue to learn immense amounts from him, and I appreciate all of his guidance that he gives me in my research career and endeavors. And yes, it's interesting. I'm glad you're getting both of our perspectives, because I probably tend to be a little more clinical in what we actually do in therapy when we implement these types of interventions.
Sure. Well, I think it's good to have all those perspectives, right? It's good to know the sort of context, the foundations for all we do things, but then it's another thing to actually go look, well, what happens when the rubber meets the road? What does this look like in real practice? So, you're even given some really great insights there into, well, it's maybe not so fun, right? To have a mitten on your arm for 8 hours a day and doing these really intense interventional sessions, these therapy sessions. So that's something that's a bit of an honest appraisal, I think, and that's good for people to know.
It is. And I encourage any patient or research participant I work with to ask questions and to make sure that you understand. I think a big part of where therapy is going is we're trying to get away from the therapist doing to the patient. And it's much more of a
collaboration, right?
Yeah,
exactly. Yep.
So getting your feedback, getting the patient's feedback, and working together and figuring out how can we make you better, whether it's the movement in your arm and hand or your leg and your foot, or if you're having cognitive problems, thinking problems, memory problems, or just figuring out how to do something that you want to get back to doing.
Sure. Yeah, I mean, and kind of speaking about that, you mentioned some of the projects you were involved in over the years. And so you're now kind of in this transition period where you're going to be starting, or you've already started at Georgia State and the occupational therapy department. I'd be interested to know kind of what are your goals? Being faculty there, you have to do some teaching, right? But you also have the ability to do some science. So I'm interested to see, what are the kind of questions that's motivating you these days? And I guess sort of to parlay on that, well, is there any activities or are there any projects that people could engage with you on?
Absolutely. I have lots of questions, and I really value everybody's feedback and input into those questions, whether it's, Dr. Wolf, who's an established researcher, and it's great, Dr. Housley, who is an innovative, great person, but equally as well, all of the participants, anybody that's a stroke survivor and their care partners. So some of the things that I'm really interested in, questions I have, are how can we advance these rehabilitation treatments, such as task-oriented training and constraint-induced movement therapy, and maybe make them more accessible to people. Can we do it remotely, especially in the era of COVID, where it seems like everything is remote? Is it possible to do some of these rehab treatments remotely? And it's also difficult can be difficult for people after you've had a stroke to travel, to be able to even just physically go to a therapy location, or schedule a therapist to come to you. So if we can do something remotely, that's a big thing I want to look at and question. I'm always
this is something that's really right into our wheelhouse too, Dr. Rowe. I mean, this is one of the reasons why we think we could have a great partnership, kind of to work with some of the Motus hand, the Motus foot, and use these as a potential tool and kind of investigate some of these new concepts of, can we do these things remotely? Can we actually facilitate these sort of classic intensive in-person sessions, interventions, as you used earlier? Can we externalize them maybe to the home? And this could be a great conduit using the Motus Hand, Motus Foot, this sort of pipeline, if you will, this platform.
Absolutely. I see the Motus Hand and Foot as being able to give people more opportunities to increase that repetition and intensity of their movement, and in hopes that that would carry over into your functional daily life. You know, you don't want to just do the Motus Hand and Foot, but maybe by doing that and getting that extra exercise, hopefully that'll help you to be able to cook your meal, or clean your house, or bathe yourself, dress yourself, or do your hobbies and your interests. Definitely.
Sure. And the other thing that you mentioned too, this is kind of on the interventional category, but you also mentioned in your sort of introduction about the things you're interested in on the assessment side, right? And the assessments, again, one of these sort of fancier words that we use in a clinic, but effectively this is like evaluating, measuring, understanding what kinds of things you can do now. And then that's, I guess, with the utmost importance of trying to figure out, well, what kind of things can we do to help you improve those given tasks? And so maybe tell me a little bit about your interest on that assessment sort of a category or subcategory, if you will.
Yeah, so you're right. An assessment is a test, basically, or a scale. Much like if you want to lose weight, you need to weigh yourself to see how many pounds you are, and then hopefully you'll do some things to lose weight, and then you'll weigh yourself again, and hopefully you'll see the scale go down and you've lost some weight. So in therapy, we do assessments or tests or measures to see maybe what kind of movement you have, how you're able to balance, to walk, to manipulate or handle things with your hands and arms, how you're able to think. We also assess your perception of things. How do you feel like you're doing it? Are you satisfied with the way you're doing it? So I'm interested in a lot of those different things. Some of the specific components or areas of assessment that I'm looking at are standardized assessments, tests that we know that are very reliable, very valid tests. Again, can we do some of those remotely? It'd be nice as a therapist to be able to do a standardized test, one that I have a lot of confidence in, remotely, to get an assessment of where somebody's starting, and then hopefully where they are as they're progressing in their therapy. So I'm looking at that. I'm working with a large study currently where I actually train other therapists, and we call it standardizing, making sure all the therapists are doing certain assessments in the exact same way. So that's a big interest of mine. And one of a big study I'm currently in the middle of is looking at, can we do I've chosen one of those assessments that looks at how you're able to move your arm and hand, comparing it when a therapist does it remotely, like over Zoom or WebEx or video conferencing. Does the score, when we do it that way, look the same as when we do it in person? And we're starting to collect some data on that in Atlanta.
Interesting. Yeah. I actually have a question here coming for you about something you're talking about here, Dr. Rowe. Mentioning, and Jerry in the live stream here is mentioning, Jerry's a regular on the Rehab Power Hour and is a Motus Hand user. And has been using it for, I think, probably the better part of the half a year at this point. We're getting some really nice improvements, reductions in tone and improvements in function, which is great. But Jerry's mentioning basically goals. How do you incorporate individuals' goals, because those are quite diverse, and how do you kind of reconcile that with maybe a very specific and valid and tractable outcome measure? Are those two things mutually are they incompatible, or tell me a little bit about how you incorporate goals?
Yeah, that's a great idea. So we have lots of different types of tests and assessments that we can give. One of them in particular that I like to use a lot looks at your goals and actually ask clients to identify what are some main goals that you have, maybe in the area of self-care. Are there certain things that you want to be able to do better, like brush your teeth, get yourself dressed, take a bath, be more thorough? Are there goals that you have as far as blanking, sorry, on leisure activities or, things that you want to be able to do, and goals you have within what we call the work area. And work can be anything from, taking care of a family member, to taking care of your house, to going to work, to driving, to volunteering, all those different things. So asking a person to actually identify goals first, and then asking them to rate on a scale of 1 to 5, how satisfied are you with completing that goal, and how much do you want to improve upon it? And sometimes looking at that and rating it that way. We also use, no assessment covers everything, unfortunately. So we might use that goal, or assessment. We might use other assessments that look at your physical movement to be able to do that task as well. And so combining a bunch of different assessments gives us a better overall picture of how you're able to move.
Yeah, that makes sense. You're also mentioning it's not, these assessments that we're talking about are more broad than just taking out a timer or a stopwatch or something like that, or measuring some kinematics. There's also this idea of self-efficacy, right? And sort of a quality of life. And these things are also very important for us. It's one thing to just be able to move, but are you satisfied with it, right? How does that make you feel about your capacities in life? And those are important metrics to measure as well.
They're huge. And again, I think that goes right along with that collaborative relationship we want to have between therapist and patients, because I can set goals for you, but they're probably going to be things I think are important. It's better for us to set goals together to come up with those that are important to you and what you want to be able to get out of therapy.
That makes sense. That makes a lot of sense. I have another question here, Dr. Rowe, from Don in the live stream. He's asking, maybe this is a very specific question. It might pull out your OT practitioner hat here to answer this one. The question from Don, thanks, Don. What would be the approach for a patient who cannot extend their finger but wants to be able to pick up objects such as a cup?
Oh, that's a great question. And I wish I had the magic pill to give you to be able to do that, because sometimes that extension to pick something up is really, really hard, especially if you have a lot of tone. There's a lot of specific exercises we can recommend. The first thing I would say is choose activities that are important to you. For example, I love to eat. So eating is very important to me. I like to be able to pick up my sandwich. So it's not just picking up, but I have to open my hand to grab that sandwich. And I would much rather grab a sandwich that I'm going to eat, or maybe potato chips or popcorn or something like that. Much rather do that than grabbing a dust rag and cleaning my house, which I don't like doing. So choose activities that you like to do. And focus on that part of extension. Think about everything that you do. How much can I open my hand? Unfortunately, it's very common that people think, I want to get better, move my hand better, so they'll squeeze a ball, or they'll focus on making a fist, squeezing something, and that's great for that flexion in your hand. But if we don't work the opposite muscles, the extension in the hand, that can be really hard and can make movement extremely difficult.
Yeah.
A very quick, simple exercise that I've found patients like to use. If you're sitting around watching TV or not doing anything, obviously, first thing I would suggest is using the Motus hand. That would help a lot. Another very simple thing is putting a rubber band around your fingers and trying to stretch it out. And you might start with maybe a bigger rubber band that's not as tight, so that you can get a little bit movement. But as you get better at it, make it a rubber band that's smaller or tighter, and slowly do that. And that's something you can easily do, while you're sitting watching TV, or if you're riding in a car, and carry your rubber band around.
And that's this idea. Yeah, and that's this idea of progressively adapting the task difficulty to make sure it's hard enough. And I think, it's kind of maybe the other side of that coin, Don. Maybe another task that you could do. I like to do these as well when I was doing like modified constraint programs for remote stuff. Is we would identify exactly what type of goal aperture you wanted to get. And I'm using the word aperture here, but basically you can imagine, like, let's say I want to pick up my coffee cup. Much like Dr. Rowe likes to have good meals, I really love my coffee. And I am not a happy person on my coffee. So I would be very motivated to try to pick up a coffee cup. So let's say hypothetically, I couldn't actually get the aperture. I guess we'll use one that's maybe not so full. Let's say this is my coffee cup, and I had to get the actual aperture here to get to hold this coffee cup. And let's say I couldn't actually do that to start with, but you can start with something a bit smaller, right? About getting maybe a smaller aperture, maybe something like a pencil, right? That seems harder because it's more fine motor, but just trying to get that aperture of your fingers in a smaller capacity and then slowly progress to a larger and larger diameter. That could be another way to kind of get that sort of starting small and increasing complexity up to the goal, which is super important, like Dr. Rowe mentioned. So that's just another kind of potential solution there for you, Don. But I do think, doing a combination of, getting that capacity, building up those muscles and the extensors, as Dr. Rowe mentioned, with the hand mentor can be really, really quite helpful. And then but of course, you have to then translate that into real functional movements. And so whenever I was doing this in actual practice, I would have people actually do 45 minutes, an hour with the Motus hand. And then we would go straight into, kind of prime the system. And we go straight into a task that was really, really important to you, such as picking up a can of soda, or, holding a brush to brush your hair, these sorts of things. So I think doing that kind of paired approach can be quite helpful. But of course, making it something that's relevant to you is also going to help you stay motivated, because it is going to take a lot of repetitions to do.
Can I offer another example that I think is really pertinent, especially to this? I actually had a client that I worked with, and I asked her one day, what's something new you want to work on? And so she came up with the goal of, she said, when I get dressed in the morning, I like to take my nightgown and throw it on the bed. And that's where it lives during the day. That's what I do with it. I would have never chosen that goal, but that was important to her. And she said, I can't throw my nightgown. It just drops on the floor because I can't open my hand. So I asked her, I'm like, well, that's a really good goal. What do you think you can do to get better at it? And we were sitting in her living room at the time. And she said, maybe if I practice just throwing. And she had some old newspapers sitting next to her. She said, maybe I'll just wad these newspapers up and throw them into the trash can. I said, that's a great idea. So the trash can was all the way across the room. And she was like, oh, that's too far away. Bring it closer. So we brought it closer, and she practiced throwing trash into the trash can. When she got better, we moved it farther away and kept doing it. When I left her, or when I finished the session, I said, okay, you've done great work today. What are you going to continue to do when I'm not here? Because that's really where you get a lot of work. And she said, well, I'm going to keep working on this, but maybe I could also practice throwing my clothes into the washing machine. So she would have to open her hand up to throw them. She had a dog who loved to play fetch with the ball. So she said, I can throw the ball to my dog and have him pick it up. And she liked the rubber band idea too. So she worked with that as well. The next time I saw her, I asked how she was doing, and she was so happy. She said, I can throw my nightgown onto my bed and work it out. And she figured out kind of on her own, really, how to progress and adapt the tasks to make them more difficult so she could get better. And she said, it was the finger extension or the spreading her fingers out, but it was also the timing of it. Being able to release something and spread it out. So I love using that example as for a much different.
That's a good one. And it also exemplifies the complexity of sensory motor movements, right? Because it's not simply just, do you have the capacity to do something, but it's, do you have the capacity to do something in the appropriate dimensions, in the time dimension, right? Because that idea of throwing it, but you have to really be able to release at the precise moment, right? Many people have built their careers and their livelihoods around this, professional athletes and sports men and women. And so it's just, just like them, we have to learn the timing of the movements too. It's a really nice point there. So Dr. Rowe, I know you have potentially a couple of ongoing studies going on right now, and I want to make sure we can get enough time to go to a couple of our users. But I want to give you an opportunity too to maybe let everyone know about your ongoing studies, and if they would like to participate in them, how they could kind of get in touch with you.
Absolutely. So the one study that I'm doing, it's within Atlanta, and it. For that study, you do have to physically be in Atlanta, because we are looking at that remote comparison of doing an assessment or a test remotely and then doing it in person. So the person in Atlanta. So if you're in the Atlanta area, we'd love to do that. I'm also involved in a larger national multi-center clinical trials that's in multiple different areas all over the United States, one of them being in Atlanta, looking at brain stimulation along with therapy to see if that can help improve movement in the arm and hand. And I would be happy to hook you up with a site that's maybe nearby. It does require to be in person for part of the assessment and obviously for the brain stimulation. But that's a really exciting study that's going on. And I've in the works and in planning, a study looking at task-oriented training, or that rehabilitation treatment to be done remotely, to see how effective it is, how feasible it is. Is it even possible to do this? Is it safe? Do people like it? That one's sort of in the works, but I'll still throw that out there because I would love feedback and love participation in the future.
Sure. Well, how about this? We can maybe set up a regular occurrence, and you can let us know when you have new projects going on. We can have you back on, and you can tell everyone about it, and maybe tell us what you learned about the previous project. So I'd love to have you, come back on in maybe a few weeks or a month's time when things become more solidified. And I'll just mention, guys, if you are interested in participating in any of these studies, reach out to us, and we will put you in touch with Dr. Rowe, and we'll be sure to get you in touch with the appropriate research coordinator so you can get involved. So that's going to be great. We'll also post some information on the support group and also on the main website. So you'll be able to sort of learn a little bit more about that. We can kind of, I'm sure we can get one of those one pagers and sort of consent forms from you, Dr. Rowe. We can kind of share that around with everyone to see if you're interested. Does that sound okay, Dr. Rowe?
That sounds great. I have colleagues too that have other studies going on looking at different types of therapies and interventions for stroke rehab that also involve care partners or family members that I'd be happy to do. And feel free to reach out to me personally if you want to give my email address. I'd be happy to field questions. Or
we'll be sure. Yeah, we'll post that. Certainly, we'll post that with the video here in the notes, and then we'll also be sure to send that out to everyone who's interested.
Great.
Excellent. Well, Dr. Rowe, I really appreciate your time. This has been wonderful to have your expertise and to kind of share a little bit about who you are and what you're interested in doing. And I think everyone here really appreciated that. And now that you kind of introduce yourself to the community, maybe we can have you come back on, and maybe we can get into the weeds about maybe one of your papers. We can discuss some of that and some of the maybe more specifics about what you've learned over the years. That would be great as well.
Thank you. Thank you very much for your time. Thank you for having me. I really like being here.
Yeah, of course.